Hi everyone, I'm Angeline Trin. I'm a child psychiatrist at UTMB, part of the Child Psychiatric Access Network. Thank you so much for taking your time out to learn about CPAN, and I'm here to talk more about it. Senate Bill 11 was passed last year in 2019, and it established the Texas Child Mental Health Care Consortium to address the mental health care gap in kids. It includes the 12 Texas medical schools, and they split up Texas into regions according to the location of the schools. So UTMB is providing services for our region. So the consortium developed 5 initiatives, CPAN being one of them, and that's what I'm going to be talking about today. I'm also going to mention later about the Texas Child Health Care Access through Telemedicine, TCHAT for short, just so you'll be aware of it. But right now, we'll talk more about CPAN. The goal of CPAN is to support pediatricians and PCP to treat children and adolescents with mental health care needs by consulting and educating. We connect the primary care practices to regional hubs of mental health care experts. The ultimate goal is to cultivate relationships between providers. We want you to use us as a resource. We won't provide direct evaluation of patients, but we can help direct patients who need ongoing care from a psychiatrist, like assisting in diagnostic and treatment decisions. CPAN will also provide local resources such as therapy, advocacy, or support. So how CPAN works is, say you have a question about aggression in a 4-year-old. You're wondering what's the diagnosis, whether it can be treated with therapy, or do you need to start medications. So you would call the CPAN number and get connected to our resource specialists. If you need resources like places for therapy or support groups, then she can provide it right away. If your question is better addressed by a child psychiatrist, like medications or diagnosis, then you'll be connected to me or another faculty member within 30 minutes, but really immediately because there aren't that many calls right now. But say you're too busy at that moment and would rather be called back later, then you can tell us a callback time window. I mentioned earlier that we can help with diagnostic questions and treatment recommendations, as well as level of care questions, and give therapy resources. The things we want you to know about the service is that we don't directly evaluate the child. It's like a curbside consult. You're going to provide us with all the information about the case, and we work with you to address your questions, like the diagnostic and treatment decisions. The patient stays in your care. They will not be transferred to us, and we just help with the questions that you may have when the patient is in your care. When we give resources, we still go through the usual referral process. The service doesn't speed things up for the patient to be seen by a psychiatrist or a therapist, but we can help treat the patient while the patient is waiting to be seen by a specialist. The other health initiative I mentioned earlier is called Texas Child Health Access Through Telemedicine, TCHAT for short. It provides telepsychiatry or telepsychology to students through the school districts. So the kids seen through TCHAT are limited to a total of 4 visits with the mental health specialist. Then they will be sent elsewhere for a continuation of care, which would most likely be you, our PCP. So in this situation, you could call CPAN to help with their care. To learn about the participating school districts, you can call the CPAN number, and to learn more about the TCHAT program, you can contact our program manager. The contact information is on the slide. To get enrolled into CPAN, you can just call the toll-free number 1-888-901-CPAN, which is 2726, or you can email us at cpanprog@utmb.edu. Even if you don't enroll, you can still use the services. Our goal is for you to use us as a resource, and hopefully through the process you end the call with some tidbit of information that you can use for future cases. I want to stress that the service is free with unlimited access, so please call us and keep calling us back.